High blood pressure, also known as hypertension, is a serious condition that affects millions of people worldwide. It can lead to a variety of health problems, including heart disease, stroke, and kidney damage. Therefore, it is important to diagnose and monitor high blood pressure to prevent these complications. In this tutorial, we will discuss the diagnosis and monitoring of high blood pressure, including blood pressure readings and frequency. Blood pressure readings. Blood pressure readings are a measurement of the force of blood against the walls of the arteries. It is recorded as two numbers, systolic and diastolic pressure. Systolic pressure is the force when the heart beats, and diastolic pressure is the force when the heart rests between beats. Blood pressure is less than 120/80th of a millimeter Hg. However, high blood pressure is diagnosed when a person has consistent readings of 130/80th of a millimeter Hg or higher. To get an accurate reading, it is important to follow these steps. Rest for 5 minutes before taking the measurement. Sit with your back straight and both feet on the ground. Place the cuff on your upper arm and ensure it is snug but not too tight. Take at least 2 readings, 1 minute apart, and record the average. It is also important to note that blood pressure can vary throughout the day and may be affected by stress, caffeine, and physical activity. Therefore, it is recommended to take readings at different times of the day and in different settings to get a more accurate average. Frequency of monitoring. For people with high blood pressure, it is important to monitor their blood pressure regularly to ensure it is under control. The frequency of monitoring may vary depending on the severity of the condition and the treatment plan. In general, the American Heart Association recommends the following. People with normal blood pressure should have their blood pressure checked at least once every 2 years. People with elevated blood pressure 120 to 129, less than 80 mm Hg, should have their blood pressure checked more frequently, such as every year. People with high blood pressure should have their blood pressure checked at least once a month or as recommended by their healthcare provider. People with certain medical conditions or who are taking certain medications may need more frequent monitoring. It is important to follow the recommendations of your healthcare provider. Conclusion. Diagnosing and monitoring high blood pressure is important to prevent complications and ensure good health. Blood pressure readings should be taken accurately, and the frequency of monitoring should be determined by your healthcare provider. By following these guidelines, people with high blood pressure can manage their condition effectively and lead a healthy,